Welcome to the Genius Factory. Enjoy the video.
You start by preparing. Book a trained clinician for cast removal and arrive on time. Once done, wear loose clothing so the limb is accessible and bring a small towel or padding to catch debris. Make a concise note of symptoms, pain, numbness, increasing swelling, or foul odor, and tell the clinician immediately. This helps them assess healing and safety. You're not performing removal yourself. You're optimizing the encounter so the provider can proceed efficiently and safely. The clinician first examines the limb and confirms the fracture or injury is healed enough for cast removal. They check circulation, swelling, and skin condition. Then they use specialized cutting tools designed to separate the cast without cutting skin. Expect vibration and some noise, but minimal risk when done correctly. Once the cast shell is split and removed, the provider will clear packing material, inspect the skin for irritation or breakdown, and explain immediate care steps for the After the cast comes off, follow the clinician's plan. Gentle range of motion exercises, recommended dressing or moisturizer for dry skin, and any weight-bearing restrictions. Make sure to ask about physical therapy if stiffness persists. If you experience worsening pain, new numbness, fever, increasing redness, or drainage, contact the clinic immediately. These are signs something went wrong. One key troubleshooting tip: if swelling or severe discomfort develops, elevate the limb and seek urgent care rather than attempting home fixes.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.